My name is Brooke from Section 2, and today I will be demonstrating administration of an IV med via the minibag. So first I would check my physician's orders and verify the correct medicine, dose, route, frequency of the med, assess the patient's lab values and history of allergies. Today the doctor has prescribed vancomycin. The action is to bind a bacterial cell wall. It's bactericidal. The implication is severe systemic infection for MRSA used in patients allergic to penicillin. The recommended dose is 500 milligrams every 6 hours. Side effects include red man syndrome, ototoxicity, and nephrotoxicity. Contraindications include allergy to the drug if patients taking aspirin, aminoglycosides, and loop diuretics. Nursing implications would be the baseline whisper test for cranial nerve 8, check for renal functions, Coltrane sensitivity before given the first dose. Time to be infused is 60 minutes. The drop factor would be 8 drops per minute, and the 50 milliliter bag, and the tubing is 10 drops per milliliter. So at this point I would add my medication to my bag. I'm going to draw up 500 milligrams. First I would wash my hands and draw up 500 milligrams of my medication. Side. And I would add my medication to my bag. Put my blue cap back on. I would write on my bag the client's name, the drug, the dosage, the time of the administration, and my initials. And now I will attach the needleless device to the tubing and label the tubing with the date, time, and my initials. So I'm going to attach my tubing to my bag. Clean with alcohol. Okay. Now I'm going to draw up 6 mLs of saline. And so now I'm going to walk into the room. I have all my items together, and I will I'm going to identify the client. I'm going to explain the procedure that the doctor has ordered a IV med via the mini bag. I'm going to double check with the patient their name. Can you verify your name for me and your date of birth?
John Jones, 2222.
Okay, very good, Mr. Jones. Matches the wristband. I've seen in your chart that you don't have any allergies. Is this correct?
That is correct.
Okay, very good. So now I will wash my hands, and I'm going to apply clean gloves. So I'm just going to assess the site of the IV. Just make sure that there's no redness, pain, swelling, infiltration, edema. And I'm going to begin the ASASH procedure, which is to aspirate saline, administer saline, and then heparin. So I'm going to clean the port with alcohol. I'm going to clean my port with alcohol and then insert the needleless device. Flush the line with 10 cc's. 3 cc's, I'm sorry. And then okay. So now I'm going to apply the tubing. Alcohol, alcohol. Establish the flow rate. It's going to be 8 drops per minute. So I'm going to observe the infusion periodically until it's complete. I'm going to wash my hands and take off my gloves using aseptic technique and just observe for signs and symptoms of any adverse reactions. Okay, so now I'm going to unclamp the tubing. It's going to infuse over 1 hour. I'm going to unclamp the tubing. And I'm going to flush my other 3 mLs in the line. Using the push stop method. Clamp INT simultaneously as you withdraw the syringe. No, I'm supposed to clamp. I was supposed to clamp. And then the H of ASASH is only used when heparin is used to flush a central line or a PICC line. And I would dispose of all my needles and syringes in the sharps container. And I would monitor the site for edema, pain, tenderness, and any allergic reactions. And on my MAR, I would document the time, dose, and route, state the condition of the IV site when I left the room, the time, the date, the dose of 500 milligrams, the drug, vancomycin, into the right forearm, peripheral IV, the condition of the site with no redness, swelling, infiltration, and phlebitis.